All right. Well, two big stories. Well, I guess a couple. One, ADA SmileCon was last week, or just finished up, I guess, within the last day or so. Lots of activity, flurry of activity. New president has been named. I think there was a clear message about fiscal responsibility and being more transparent. We'll see how that translates over the next year with new leadership. But I think that everybody's intentions were really good. So hopefully, we'll continue to see the ADA flourish. In other news, this kind of wasn't on my radar. I totally missed it, and so for that I apologize because I really do take a lot of pride in bringing you guys news that's really relevant and current. But I sort of missed this massive merger that happened with the dental examiner boards between CDCA, REB, and CETA all joined forces, became the American Board of Dental Examiners, ADEX. And now that represents almost 98% of dental licensure exams and dental hygiene licensure exams in the US. I watched an interesting podcast on Dr. Bicuspid about that merger from the president of ADEX and sort of what their overall scope of joining forces together. And I think that there's a lot of good things that will happen. Certainly, it standardizes licensure amongst all states. And in theory, we should have clinicians that are of equal level of competency throughout the US. So I think that's a plus. And he also did state that for the last 3 years, they have not raised their prices for licensure examinations, which is a huge kudos to them as well, because there is financial compression. And I think he's basically highlighting that this merger would allow them to continue to keep it affordable. I do worry that now with that final merger, that's 98% market share. In my books, that is a monopoly. And so it does become a little bit more concerning that could allow for increased and unchecked price increases that are unchecked, oversight and overviews, and changes in licensure examinations that are somewhat unchecked as well. So hopefully, there's transparency to be had there. And certainly this plays quite well with the compact and other um, ad- advancements that are happening in the licensure space to allow freedom of movement for all clinicians. So we'll continue to see how all this plays out. The last little bit of news is important because of who our guest here is this evening. We wanted to give you the 2026 update, a few highlights that I think most GPs would be interested in. There are over 60 code changes, including 31 new codes. I'm sure Greg will highlight some of those new ones for us, but these are just a few that were interesting to me. Therefore, I'm inclined to share. We're now going to see a code for point of care saliva testing. I love that we're moving towards the diagnostic testing codes. I really hope insurances also start reimbursing for that. When we can start doing rapid testing, saliva testing, perio testing, et cetera, we can get real data very quickly to patients, looking at bacterial loads and giving them guided advice on next steps. So I love the movement and any way towards laboratory testing chair side and giving patients quick information that they can digest and process. There's a new code for testing for cracked teeth. This will go right alongside with pulp vitality testing. So you'll be able to also code for testing the cracked tooth, which we all know probably includes a tooth sleuth or some type of binding mechanism. Maybe it's an intraoral scan to look at the occlusion to see if you can figure out where some of the pain symptoms may be coming from, but we can now code that as well. A duplicate denture code is also on the books, which I love because most of my denture patients come with multiple dentures in their treatment plan because we want to make them a really great first set. And then we want them to either digitally store that really nice denture, or we would like to go ahead and fabricate them a backup set that they can keep available at the house. So now you have a code that you can submit to insurance for that duplicate denture. How that will play out with frequencies, I'm sure Greg can provide us a little insight into that. I'm not sure. I would imagine they all fall under the same frequency code, but at least you have a billable CDT code that you can bill and you can pass that charge along to the patient. There is scaling and debridement around implants with peri-implantitis. So now we have better coding for when we open those areas up to get around those implants and try to get them nice and clean. So that's an improvement, I think, as well. And then finally, cleaning and inspecting the occlusal guard. We do this as a courtesy pretty frequently. Patients come in for recare visits. They bring their guard in. We check it out. We check the bite, make any adjustments, smooth it up, and we throw it in the ultrasonic and clean it. That does take staff time and it does take doctor time. And now there is a CDT code that might accurately reflect that. So, just a few highlights from the new codes that will be coming out. Of course, you should always get your updated CDT coding book to get the full review. And then, of course, I'm sure our guests can talk to you more about coding with confidence so that you can be optimizing these codes to best suit the revenue and treatment planning for your patients. And with that, that's the news.